we have three speakers. Our first speaker will be Dr. Sabbitan, who is a psychiatrist. Our second speaker will be Dr. Anasuya, who is a licensed counselor. And our third speaker is a lawyer by profession, Sister Sippa Selvaratnam. So thank you for y'all being here today with us. So without further ado, I would like to pass on this program now over to Dr. Sabbitan. He is a very busy psychiatrist in his own right, working with the Ministry of Health, and currently he's based in a hospital in Malaysia. Brother Sabbitan, over to you.
Thank you. Today, I'm here to speak on a very important topic, which is often missed and perhaps sidelined, I would say, is understanding childhood trauma. And in childhood trauma, we will be focusing on adverse childhood experiences or ACEs. So you will see a lot of ACEs here. So in our upcoming slides, ACEs means adverse childhood experiences. Okay. So the entire theme of today's presentation, if there's something that you can take away from this presentation, it would be changing your perspective. When you approach someone or a child from the initial way of thinking would be, what is wrong with you? But hopefully after today's sharing session, you would be able to change your perspective from what is wrong with you to what has happened to you. What has happened to you in your childhood, and hence that is why you are who you are today. All right. So we are trying to change your perspective, because when you look at the first shift here, the first box here, it is it is pure judgment and it is pure blame, and this doesn't end well. And when you look at the second box here, when you change your perspective, what happened to you, it opens a room for understanding and delving deeper into the human consciousness and trying to understand why someone is who he is or who she is today. So let's start with Maya. So Maya is an 8-year-old girl. She frequently complains to her parents of unexplained tummy aches, sudden outbursts of anger over small things, appears quite irritable at home, even at school. Sometimes the teachers call the parents and inform the parents that, she's been behaving quite aggressively lately at school. She perhaps maybe beat a friend or two, and she clings on to her parents at night. She doesn't want to even sleep in her room by herself. And so the whole journey of this presentation is to understand what has gone into, why is Maya manifesting this behavior? We're trying to understand, not blame Maya, why is she this way, but we're trying to understand what has happened to her. And so we move into understanding adverse childhood experiences. So adverse childhood experiences are potentially traumatic events that occur in childhood from ages 0 to 17. So why I say potentially traumatic? Potentially traumatic meaning to say that I use the word potentially because an event can evoke two complete different reaction to two child. Okay, let's say you have child A and you have child B. The event is the same event, but child A may end up being traumatized by the event, but child B may be able to tolerate the event. So what is the difference? Why child A cannot tolerate the event? Why child A is traumatized, but child B is able to tolerate? It is because the nervous system of child B is able to regulate the event which has taken place compared to child A. So it is not the child per se to be blamed, but it is the nervous system which we can do something about. So delving deeper into ACEs, right? This concept of adverse childhood experiences started from this Kaiser study conducted in 1990s. And what this study actually did is that it partnered with the CDC and they surveyed over 17,000 adults in the world. And what they had found is really shocking to the medical, it was really shocking to the medical fraternity at that time. They discovered a direct link between childhood trauma and adult health, be it physical, be it mental health. And so they also explained that there are three types of adverse childhood experiences which often affects children. And the first is abuse, second is neglect, and third is household dysfunction. And we're going to go more into this to understand how each and every facet here can potentially traumatize a child. Now, abuse is pretty much, I would say, common in the Malaysian community. Though we may choose to hide the, um, effects of abuse by smiling when we are with our friends or at work or wherever we are, but there can be potential abuse that which is happening at the background of our lives, either wife who is being abused by the husband at home, vice versa, or it's the child who's being abused by the parents at home, or even by the babysitter, or anyone at all for that matter, right? So when we look at abuse, we divide abuse to physical abuse, emotional abuse, and sexual abuse. Physical abuse is more like hitting, beating, biting, all the physically inflicted harm on children. Emotional abuse is what we commonly see in schools nowadays, right? When they isolate someone, when they blame someone unnecessarily, they ostracize someone. So when they do things like this, it to an extent invokes a negative emotion in the child to an extent that the child experiences a traumatic event. And sexual abuse, we are well aware of what are some of the sexual abuse. We are well aware of a few cases of sexual abuse in the news right now, which concerns teachers at school, especially commonly seen in mm, schools which has dormitories and all the asrama school, boarding schools. Yeah. So you commonly see these kind of sexual abuse cases, especially in some of the religious schools as well. Next, we move to neglect. Neglect, harm is inflicting harm, physical, emotional, or sexual harm. So you're inflicting something to someone. Neglect is completely opposite. You devoid that person from something, meaning to say you don't give them attention, you don't give them love. This is called more of emotional neglect. When it comes to physical neglect, it's more of I don't provide you enough food, I don't give you enough shelter, and there's no safety around you. So this can actually predispose the child or precipitate the child to constantly being in a period of stress over a very long period of time and eventually develop trauma. And finally, household dysfunction. Household dysfunction is very sad because some children are just born to parents who are addicts. Some children are just born to parents who fight every single day. Parents who are going through a rough divorce. Parents who don't know how to communicate. Parents with mental illness. Parents going through domestic violence. These children they just happen to be born in that family. And so they develop trauma because of this household dysfunction. And now there's a new category which has come into the initial three categories, which is community or systemic adverse childhood experiences, such as race and discrimination. When you are an isolated race, which is often marginalized from receiving something, right? or a community where you live in a community where there's violence towards your community, such as when in Pakistan or in, usually in war zones or war areas. And finally, poverty and housing insecurity. So what happens over a period of time when the child is exposed to these ACEs, right, adverse childhood experiences, the ACE scores will slowly start to increase over a period of time. And this is called the cumulative effect. So this risk factor is not a diagnosis. Just because your ACE scores are moderate, it doesn't mean that you have a mental illness. No, it just means that you are predisposed to developing traumatic events. And number two, you're also predisposed to developing mental illness or physical illness in the future. And so we move to this neuro pyramid to understand that children, or anyone for that matter, requires safety and survival to be built first. It has to be the base of our human experience. If we don't feel safe, we cannot experience emotions and connections. If you don't feel safe, you cannot experience even complex thoughts. So that is why safety and survival, what basic survival needs has to always be at the base of human experience in this world, at least in this world. And so when we move up this ladder, there is a hierarchy of needs, which is coined by Maslow, which says that as you move up this ladder, as you move up, when you provide a child with survival needs and also safety basic needs, and then you provide the child with emotions and connections, and only then the child is able to think of complex thought, is able to understand what's happening. This does not only apply to children, but also applies to adults as well. And so, what is stress? Stress can basically be divided into three types of stress. The common misconception about stress is that stress is always bad, but this is not true. Stress is not necessarily bad, and that is why we have three types of stress. The first is the green color, as you can see on the screen. It is called eustress, EUST. So these are stress which is considered positive, just like exams are considered eustress, because though it is very stressful when we're preparing for exam, but once we pass the exam, we understand, and as I think we can all agree here, that it actually helps us to grow. However, we also have the yellow color here, which are tolerable stress which often happen maybe once a month or twice a month, right? But in a child's case, maybe bullying that has happened in the past, which is not intense, happens maybe once a month, and this is just like maybe verbal, not physical, and it's just in a small group. So the child still has some amount of support, so it can be tolerable for the child, right? And usually children which are experiencing the stress, which is at the yellow level here, they are usually able to regulate the stress because of supportive parents or supportive adults. And finally, you move to the third stage, which is toxic stress. When we look at toxic stress, it is basically exposing yourself to a hostile environment on a daily basis. Okay? Some people just cannot stay in that environment. They just feel the environment is too overwhelming for them. Overwhelming for them, meaning to say it is in their nervous system is unable to regulate that particular environment or toxic environment. And so it becomes toxic to them, to their nervous system. So that is why other people are able to work in that same environment, but they may not be able to work in that particular environment. And so, which part of the brain is actually the culprit to the entire stress mechanism that I've explained earlier. It is the amygdala. So the amygdala is a very it's a round or oval shaped structure in the brain, which is the center of fear. Okay, it scans for danger, and it is fast and very instinctual. And because of repeated trauma, this part of the brain becomes super sensitive. So it starts to grow in size. Literally, your amygdala can actually grow in size. And that is because your child is actually exposed to recurrent adverse childhood events. And so the amygdala has actually grown over a long period of time. And that is why when they are adults later on, they develop several type of anxiety disorders, or they predispose themselves into developing PTSDs. And the opposite of this amygdala is the prefrontal cortex. The prefrontal cortex is this part of the brain just in front of here, just in front of the frontal cortex. So this part of the brain are just like the brakes. If the amygdala is the alarm which signals, so and like you have to fight, you have to flight, or you have to freeze, right? That's basically the theory of fear. But when you look at this prefrontal cortex, it's completely different. It is more of the brake. You need this prefrontal cortex to apply the brake. So these brakes are actually logic and reasoning. It calms down the amygdala, and it gives you or gives your child a total different perspective of understanding. And sometimes during therapy sessions, this is what we do. We encourage the child to name the emotions. When they name the emotions, they tame the emotions. When they tame the emotions, they see the emotions, they distance themselves from the emotions. And so their nervous system is able to regulate the emotions. It's rather surprising that this part of the brain, the brakes of the brain, is not fully developed even until the age of 25. And so this is basically the stress highway which goes through each and every one of us. The brain senses the threat. It activates these glands, this adrenal glands, which is present in your abdomen. And these adrenal glands just floods your entire system with adrenaline and cortisol. So there's nothing wrong about this adrenaline or cortisol. So these are actually natural hormones which are secreted by this HPA axis or the adrenal glands for us to be able to cope with the stress that we are going through. However, the problem is if it's just one day, right? If this express highway is the best if you come in contact with a lion or a tiger, which served the purpose when we were in the Stone Ages, right? When we were able to navigate ourselves, and just by really tuning into the HPA axis and the entire stress highway. But what has happened is when this particular highway is activated every single day over a period of 5 years, it is just similar to a draining acid from the battery, right? Which slowly over a period of time keeps you depleted and also affects your sleep, your child's sleep, digestion, and immunity. And so the child does not, when we look at we take a magnifying glass and we look at this experience of the child at the moment, you will understand that the child won't come to you and tell you, Mama or Papa, I'm actually experiencing chronic stress. No child will tell you that. And if you expect your child to tell you that, then you have to go for parenting class, because no way a child is going to tell you that. The child will manifest this through the behavior. This is how the body communicates the pain, through behavior. So, what are the symptoms of adverse childhood events? The first is you basically have three reactions. The first reaction is fight. Okay? Fight meaning that they go into a survival mode. They really become aggressive they start hitting, they become very argumentative, they go into a full defiant state, and then they become very intensely hyperactive. Unable to focus their attention, becomes very restless, vandalizing, mixing around with the wrong group of people. So they go into this fight phase, I would say. Next is flight. They completely avoid the environment. This is what we see today amongst our children who experience certain kinds of emotional abuse or physical abuse at school, where they this manifests as school refusal. When they flight, I don't want to go to school. I have patients in my clinic who has not gone to school for more than 4 years, 5 years, 6 years. They just cannot go to school. And we try our level best to rehabilitate them and get them back to school as much as possible. But sometimes it's just too challenging for them because, as I've mentioned just now, the amygdala is super sensitive and it takes time to rewire these neurons again. And the third reaction and the final reaction is freeze. They just zone out. When you speak to them, they just not there in their bodies. They shut down and they go mute on you. And this can actually aggravate a lot of parents as well. They come to the clinic and ask us psychiatrists, why is my child not responding to me? Why is my child not talking to me? I'm trying to understand, but they don't want to express themselves. The act of you trying itself sometimes can even trigger them. They just want someone to listen. They don't want someone to give them a solution sometimes. They just want a parent who just can be there with them. And that can actually help them calm down. When you regulate yourself, whenever a child tells you something and your reaction is to get angry or to get upset, or how come this happened to you? And you go just like unconsciously into some emotional state. Just imagine that child's state is all that child's neuron is already nervous system is already unable to process whatever is happening. And that nervous system expects the parents to actually regulate them. But what the parents does in return, what they do in return is that they, in fact, make them more, dysregulated. So this actually goes on in a cycle until the child just loses interest in expressing whatever's happening in their life to the parent. And whenever they meet the therapist who is able to regulate with them, who's able to form that bond with them, then they start to open up. And so inside a child's mind, right, this is how you look at these two diagrams here, the one with multiple lines crossing each other, just looks so confused. This is how a child who's experiencing adverse childhood experiences mind is like. And the other one is when they're able to regulate the emotion. When they are in intense fear, their mind is restless, just like a monkey mind times maybe 100, 200 times more, finding it difficult to focus and trouble trusting adults. And so we move to the dominoes effect. If you ask me, what's the connection with this and the mental illnesses, right? So once you have recurrent adverse childhood events or one childhood event which is not sought out, meaning to say which is not addressed, which is just allowed to prolong over a period of time, the ACE scores or the adverse childhood experience scores will increase over a period of time because they keep on getting triggered. In every situation, they get triggered. But guess what? They don't know how to regulate their nervous system. So over a period of time, just as I've mentioned, the amygdala will actually become larger and become super sensitive. Guess what? The entire brain will be messed up in the sense that it will rewire to become very sensitive, and the entire brain will be completely against their intelligence. So it alters the brain chemistry, and eventually, over a period of time, they develop depression, anxiety, and they try to cope sometimes, a lot of times nowadays, with substances. They just want to zone out from this world because they just cannot, and their minds or their brains just cannot decipher the moment. They just cannot be in the present moment. is too overwhelming for them. So substances provides them an avenue to just escape. And then, but guess what? For those of you theists here who believe in God, so this is not the end of it, right? With the traumatized brain is able to rewire itself, is able to heal itself. This is what is described as neuroplasticity. The brain can rewire and heal itself, and resilience can be built at any age at all. So there's age is not a number. Age is not an obstacle for you to start your healing journey. And how do we heal ourselves? From the psychiatric perspective, or the psychiatrist lens, we view healing from these four puzzles: biological, psychological, social, and integrated well-being, or more of a spiritual perspective. When we speak on biological, we understand that sleep is one of the most important aspects of a childhood. If you're unable to get your child to sleep rightfully at the right time and wake up at the right time, their nervous system is not going to get regulated. So you need to learn how to ensure that your child is sleeping right. One of the easiest way is just cut screen time. We need to say no screen, any form of screen, at least 1 to 2 hours before bed. What happens is, in your handphone, there's this blue light which actually travels through your eyes and goes to your brain. If you have a computer, not a laptop, you have a computer, you know that the screen, just imagine the screen of the computer are your eyes. The CPU, or the processor, is your brain, right? So just imagine you are watching things on TikTok or Instagram. They're reeling a lot of things, and over a period of time, the screen gets tired, the eyes gets tired, and so the eyes shut down. But is the CPU still on? Is the brain still on? Yes, the brain is still on, because it's still processing all the information that has been inputted through the eyes to the brain. So this actually prevents them from sleeping. I'm also talking to all the adults here who's experiencing insomnia and who is on sleeping tablets at the moment. So this is one thing that you can do to change your life. Just cut screen 1 to 2 hours prior to sleep. It's challenging, but trust me, it's worth to rewire your brain. We understand now about neuroplasticity. So we can make this, make our brain rewire itself to suit the purpose of our life. Next is nutritious food. Try to avoid as much as possible all these unhealthy MSGs and whatnot, right? And synthetic kind of foods. And finally is physical play. The more the child plays, it burns down the unnecessary, unfinished energy through play, and all the adrenaline and cortisol, which is fuming in the body, in the entire circulation, gets used up during the play. So that is why sleep, food, and play. Physical play, not esports, yeah. Physical play, not Mobile Legend and whatever they use in their phones. Not that. Physical play will help them to regulate their nervous system. Next, rewiring the mind to psychological means. This is where they seek help. They seek help from a trained therapist. I'd just like to inform you that there are many people out there who claim that they're trained therapists, and then they do all these weird kind of therapies, and and they might even potentially worsen the child's adverse childhood events. So before you send your child to a therapist, you must know if this person whom you're sending your child to is a trained therapist or counselor or not, right? Because during a formal training validated by university or certification from the university, they will teach you how to navigate a child's a therapy session with a child. Navigating a therapy session with a child is completely different with an adult. So this is where we apply CBT, or cognitive behavioral therapy, play therapy, And the most important or one of the key practices which I myself practice with my patients who are children is to name it to tame it. So once you name or labeling emotions as they are, you get to separate yourself, or your brain gets to um, conceptualize this emotion in a more regulating way. And finally, reframing negative thoughts or unhelpful thoughts to more um, helpful thoughts. And then finally, we come to the ultimate buffer, which is social. This is where I would like to emphasize to all the parents who are listening, who are here with us today. It only takes one committed adult to regulate a child. Only one. You don't need so many people. If your husband is all out going working and all that, and, it's not back at home, it just requires you can just do it. Other way around. If your wife is the one working and you are the one with the child, you can do it. It's just the child just needs one stable connection. If there's one thing good you can do in your family, is to be that stable connection. Be consistent as that stable connection with the child. Try to reduce your judgment to the minimal and try to nurture a stable relationship with them. Nurturing means not correcting all the time, but sometimes certain things can be corrected. Certain things just requires your presence. The fact that my father and mother is with me is regulating enough for me. Just imagine, how would you feel if your parents were here with you right now, or were there with you right now, right then, when you were experiencing a traumatic childhood experience in your life? They were there with you. They didn't neglect you. They didn't dismiss you, but they were just there with you. Perhaps it wouldn't have, even led to a traumatic experience. So finally, we I encourage, I or I invite all participants to be that stable connection to protect and empower your child. Now, we have understood Maya's progression. She was initially complaining of a lot of physical manifestation because of her childhood experiences, adverse childhood experiences. She was experiencing some form of neglect, emotional neglect, and also abuse in her school. And so she has decided to completely stop going from school. Every day in the morning, she will complain about stomach aches. And at the end of the day, her parents have to, bring her to a psychiatrist and get her treated, referred to the clinical psychologist as well. So after, I would say, a 6 to 8 months period of therapy and also medication, we were able to convince Maya, and we were able to help Maya's nervous system regulate itself at school. And so, using the biopsychosocial methods, we also engaged the parents. We provided the parents an avenue how they can train themselves. Sometimes we cannot blame the parents as well, because they themselves are not taught how to regulate their own emotion. They themselves might be coping in a very negative way, to just, they are at the survival mode. I just have to get through this phase. I just have to get through this phase. So once we empower the parents to learn how to regulate their emotions, then over a period of time, they become that safe haven where Maya was able to connect to. This is where my training in mindfulness really helped my clients and also some of my participants who join. So what we do is, once you are able to regulate your nervous system either by connecting to your breathing or grounding yourself to your sensations or cultivating positive human values such as gratitude, love, self-kindness, and compassion in your life, you would be able to be that safe container for your child's nervous system to regulate hers or his. So with that, I think that's about it. Thank you.